Hi family, Dr. Taylor here, and today we're going to be talking about weight loss surgeries. Now, I want you to imagine with me that you're walking outside, it's a beautiful day, and some maniac comes out of nowhere and stabs you. Ouch! Now, having a surgery is not the same thing as getting stabbed. It's more like skillful, calibrated, hopefully well-aimed stabbing. And yes, I am saying this to be a little funny, but that doesn't mean what I've said isn't true. Surgeries are risky, and that's why they should be taken seriously. So if you're curious about how these surgeries work, this video is for you. Let's get into it. First off, let's look into some unexpected factors that can contribute to weight gain. This might surprise you. Many people who are overweight are actually malnourished. You heard that right, malnourished. In the past, before we had all of these processed foods, malnourishment meant you didn't have enough to eat. But today, malnourishment is not about the quantity of food, but about the quality of it. And most people that are overweight today are malnourished because of the quality of their food. Now let's talk about emotional stress. It's not just about feeling down. Stress affects your physical body. When stressed, your body produces less stomach acid, which is crucial for breaking down proteins, vital for repair, and muscle building. There's a lot of people today that are just expected to pick up the pieces and walk off all kinds of hardships without regard to your emotional health. If you look back and notice that your weight started to increase after a particularly stressful period, this could be a big part of your puzzle. And lastly, sleep, or the lack of it. Not getting enough sleep disrupts hormones that control hunger and fullness. More hunger means less satisfaction and worse food choices. Society increases the pressure on everyone, but especially people that are overweight, making them feel like they're being lazy when really they're malnourished and exhausted. Now let's get to the real meat of today's topic, weight loss surgeries. We've just covered 3 major yet often overlooked factors contributing to weight gain: malnutrition, emotional stress, and sleep deprivation. These are real issues affecting people's weight loss journeys every day. So the big question here is, can weight loss surgeries fix any of these underlying issues? The answer is a resounding no. That being said, I'm not completely against these surgeries or other serious interventions for medical problems, as long as you're informed about the potential risks. That's what I care about. Now let's talk about the 2 main types of weight loss surgeries, restrictive and malabsorptive. The goal of restrictive surgeries is basically to shrink the size of your stomach, which naturally slows down your digestion. You might have heard of medications like Ozempic that slow digestion too. I actually have a whole video on Ozempic, so if you want to know more information about it, I'll put a link to it at the end of this video and in the description. Now, slowing digestion looks like a good idea on the surface, but it can create all kinds of other problems, and doing it surgically makes those changes permanent. Now imagine your stomach as a pot of boiling water. Let's say about 2 cups full, and you throw in a big piece of meat. Now normally it would take maybe 20 minutes for that meat to cook with the help of boiling water and steam and all of that together in a closed environment. This is how your digestion works. But here's what happens in a restrictive surgery, like putting a gastric sleeve or band. Imagine that same pot, but now it's only half a cup of water because we've restricted its size. You'll still throw in the meat, but maybe a bit less this time because that's all that fits. But now there isn't enough water boiling, and your digestive system, which was already stressed in the first place, doesn't have what it needs to break down the meat effectively, and your digestion slows and suffers. So while limiting the space means you'll eat less because you feel full faster, your body also has to adjust to making less gastric juices. It's like cooking with less boiling water. It changes the whole process. And remember, your stomach is adaptable. It's going to try to adjust to whatever, but this adjustment comes with its own set of challenges. Now let's briefly touch on malabsorptive surgeries. These go a step further by not just limiting stomach size, but by rerouting your digestive tract, bypassing parts of your intestines where calories and nutrients are usually absorbed. Now think of this as skipping a huge chunk of the journey where your food gets processed. That means less absorption, meaning less calories, sure, but also a higher risk of nutrient deficiencies because you're literally missing out on parts of digestion where vital nutrients are absorbed. And let's not forget what I said earlier. Most of these people were already malnourished. Now, both of these surgeries make significant changes to the very core of how your body handles food, but they don't address why your body may have been holding on to extra weight in the first place. Now, I just gave you 3 potential reasons, but there are so many more because everyone's body is different. Each body can thus have a unique reason for its size and shape. And it blows my mind when I really think about it. If we recognize that there's a problem in the gut, let's say it's not absorbing nutrients right or digestion is messed up, I feel like the odds of the answer being to cut out pieces of it, reroute it, or just slow down the whole process, I don't know. I feel like it's pretty low. Not that that's never the answer, but I feel like it would rarely be the answer. And what happens if you're not one of those very rare cases and you have one of these surgeries? Your gut was already struggling, and then we go in and we make these drastic changes that could potentially make it even tougher for the gut to do its job. In trying to fix one issue, it seems like we might be setting off a chain reaction of other issues. So, while we often see weight loss as a direct result of these surgeries, there's a whole list of other problems that can crop up, which can be just as challenging. I've seen patients who develop severe addictions as a result of these surgeries, like to alcohol and drugs addictions. After something like a gastric bypass, for example, you just had this surgery that changes the route your food takes through your gut. Alcohol then takes this VIP shortcut to get to your bloodstream. Now this means you get a quicker, stronger buzz. Imagine drinking on an empty stomach every time. That's your new normal post-surgery, which can seriously mess with your alcohol tolerance. Now, on the brainy side of this argument, your gut hormones do go through a big shakeup after surgery, and these hormones talk directly to your brain. They can tweak the levels of dopamine, that feel-good chemical, and suddenly you might find alcohol more rewarding than ever before. It's like your brain's pleasure centers start having a louder voice, making alcohol harder and harder to resist. Then there are issues that come up like autoimmune conditions, acid reflux, significant digestive function, and significant pain that are exceedingly common after these surgeries. Now, let's pretend you had a gastric bypass and none of the side effects we've discussed have happened to you. You'd be feeling pretty lucky, I imagine. And you got to lose a pretty good amount of weight. Excellent. But what happens next? Well, if you have a lot of excess skin, you might want to have an operation for that too. It's called body contouring or a body lift. When you cut off all that excess skin, what happens to the nerve cells and blood vessels that belonged to it? Do they just disappear? Of course not. When you remove anything, like let's say that skin, the entire stomach, whatever, your brain thinks it's still there. The nerves and blood vessels still exist. This is why we see some strange side effects after these surgeries. Your body still might behave as if it has a gallbladder or it has those patches of skin because the nerves and blood vessels that served those parts are still trying to do their jobs. And you know what's the saddest part of all of this to me is that you can be too big for weight loss surgery. Now, I'm not saying I'm suddenly in favor of weight loss surgery, but the people who have the most dangerous amounts of weight and who stand to benefit the most don't qualify for it. Crazy. Anyways, let's talk about those 3 original weight gain problems and how we can work to address them. Malnourishment. Malnourishment can really be complicated for a person with a poorly functioning digestive system. You might think, oh, I can buy organic food now and solve all my problems. But that doesn't always work because even organic food can be hard to digest for a system that's already strained. Now, that doesn't make someone's situation helpless. We have so many tools to aid digestion, from digestive enzymes to supplements and even pre-digested versions that allow your body access to the nutrients without doing a whole lot of work, gently improving your situation. Next, we have emotional stress. There are some patients that will come in and follow every protocol to the T, but healing is extremely slow or it looks way different for them. These people are usually experiencing significant stress somewhere in their lives. And this is a big part of people's healing processes and an important piece for us to talk about. You cannot heal when you are always running from a bear, period. Emotional stress has a direct effect on not only digestion, but your overall healing. It's way too important for you to just ignore or get over. A good rule here is, if it's bothering you, let's talk about it. And lastly, sleep. Sleep is so important, but it's also susceptible to all kinds of interference. For example, if you're a coffee drinker, don't be scared. I'm not going to take it away just yet. If you're a coffee drinker, maybe monitor how much you're drinking in the afternoon and evening. You could be drinking the coffee to wake up, but then it leads to poor sleep, which leads to more coffee. If your sleep is interrupted by getting up to pee too many times in the middle of the night, maybe start managing not only your fluids in the evening, but also your sugar intake. Or maybe your mind is racing and you can't get it to calm down enough to sleep. One of your main hormones, cortisol, is responsible for helping calm your system at night and getting you going in the morning. Well, if it's overactive at night because you're mentally running from a bear, it might take a minute for your body to feel safe enough to rest and digest. Chronically high cortisol and lack of rest are one of the most common causes of weight gain and one of the biggest culprits for difficult weight loss. Now remember, there are many other things that can cause weight problems. These are just a few common ones and some things that you can do right now that can improve your situation. If these feel like they describe you, or if you feel like you need more one-on-one deep dives into your specific case, you can reach out to me and my team and we can create a customized plan for your health journey. Links in the description and the comments. Until next time, family, take good care of yourselves.